The Democratic Alliance is deeply concerned about South Africa's plan for the rollout of the COVID-19 vaccine. The party wants National Assembly actually to reconvene urgently to discuss when exactly this vaccine is going to be available. It's not as clear-cut as we heard in the President's speech. So let's find out how, as a South African general public. Natasha Mazzone from the DA, we're going to get more answers from the leaders of this country. Good morning to you. There's a lot of issues regarding vaccinations and the vaccine. I understand that we can't go through all of them. Two main issues for me, Natasha. One is the payment and the dispute about the delay of payment, and two is the delay of the actual vaccine. Let's start with the payment, shall we? The DA very, very unhappy with the finance minister.
Absolutely. We've brought it up with the finance minister before, got a very dismissive answer that actually now seems to have misled Parliament somewhat, with the Minister of Finance telling us that everything was A-OK and payments had been done and that we had been spreading misinformation, when it turns out that we were quite right, that there hadn't been the initial payments done and that the payments had both been late. So what we need to find out is exactly why the payments were late. We've seen yesterday hundreds of countries across the world rolling out the vaccine, and not only rich first world countries, third world countries that have made provision to put money aside to procure the COVID vaccine and to procure enough of the COVID vaccine. So what we need to find out from the finance minister is exactly how much money has been set aside, when this money was set aside, when this decision to set the money aside was made, and exactly how much of this vaccine we can procure immediately. Because as it stands now, what we do know is that we have enough money to procure enough vaccine for only 10% of our population. And that is a very frightening prospect.
It really is a very frightening prospect, Natasha, because a lot of critics, a lot of people I've even spoken to on this channel are asking the questions. That 500 billion that came into the country, all the money spent on SAA, those critics, those voices, Natasha, are starting to come out and say, if we had all the money to do that and keep an airline in the air, or however turbulent it is, why didn't we have enough money to get more of this vaccine? So that's the part as far as payments is concerned. Now let's talk about this shifting of the goalposts, if we can. We've all been hearing the first quarter of 2021 we were going to get the vaccine, the president announcing in that family meeting. It's now the second quarter of 2021. But I think it's important for viewers to know, Natasha, before you answer, the second quarter could take us into almost midwinter of 2021. That is a big difference from the first 3 months of the year, isn't it?
Big difference. And we must remember that this virus thrives in cold weather. And it's why Europe had its first wave before we had our first wave. As Europe went down in numbers and started to recuperate a little bit in terms of buying PPE, in terms of training up more hospital staff, South Africa entered its winter period. And when we entered our winter period, of course, we hit our first spike. So the first quarter would have been reasonably acceptable. January, February, and March, South Africa, normally very hot months. And, if you're going to have the virus in and around your country, you want it to be during your hottest months. But certainly going April, May, June, you're in, especially in a place like Cape Town, I can tell you winter starts here good and proper, sort of towards the end of April. Up in Gauteng, we know the crisp winter morning starts in April. It's how we know that winter's coming. So certainly, why the delay, why the shifting of the goalposts, and why the playing down of the fact that we've shifted the goalposts a whole 3 months. I don't know about you, but I certainly want that needle in my arm. I want that needle in the arm of as many South Africans as possible straight away. And I thought that at least we would see the rollout of the vaccine starting around the end of December, going into early January. Certainly going into the new school year, I would want to see learners and teachers getting that vaccine before they start gathering in big numbers at schools. And let's not forget, a lot of us are on holiday at the moment, and we'd like to see South Africans being vaccinated before they have to go back to work.
Natasha, forgive me for asking, because I know you're about to talk about the frontline health workers. That was going to lead me to my last question to you, final question. Healthcare workers are going to rely on Parliament and the National Assembly to fight for their rights. They're going to want these questions asked from parties like yours to government. Are politicians going to spend New Year's Eve in Parliament? Has Thandi Modise from the National Assembly replied? Is this going to happen tomorrow?
She hasn't replied yet, but let me tell you, I'm fighting hand, tooth and nail. MPs are not on holiday. Ministers are not on holiday. The President is not on holiday. We have an absolute obligation to protect our frontline healthcare workers, and we have an absolute obligation to protect South Africans. I am ready to be in Parliament at 5 minutes' notice. I can be there. I expect all other MPs to do the same. We can now Zoom. We can be there in person. Our job now is to save the lives of South Africans. It is imperative, and there is absolutely no excuse for Parliament not to meet immediately to make sure that at the very least our frontline workers have those needles in their arms, and that we protect these heroes of South Africa who have been protecting us during this pandemic.
Okay, the President is not on holiday, parliamentarians are not on holiday, and also COVID-19 is not on holiday. Natasha Mazzone from the Democratic Alliance, thank you for your time.